environment, I will quickly take you through the vaccination logistics plan that has been prepared by the team headed by Dr. Melody Ennis, who is championing the implementation of the vaccination component of the COVID response. As Minister outlined, the Parliament was presented with the interim vaccination plan that had 11 component areas. Number 2 in that plan, in terms of the component area, had to do with micro-planning. Now, the interim vaccination plan is the policy directive document that gives the overall approach to how we will undertake the operations in the public health system. And so the micro-planning, the planning and micro-planning component are critical aspects of what is necessary for implementation, and that is what we're going to be presenting today. So the overall plan that was presented to Parliament set the framework in which we will operate, and one of the components being the micro plan. And so we are looking now at the micro plan. But before we look at the micro plan, we must talk about the principles that underpin the plan. The principles being human well-being, that is to reduce deaths and disease burden; equal respect, that is to ensure non-discriminatory practices; national equity, that is to develop an appropriate immunization deployment strategy to ensure that everyone who is to receive vaccine receives it in terms of the priority population; legitimacy around employing the best available scientific evidence, expertise, and engagement; and of course, reciprocity to protect those who bear significant additional burden. So these principles are adopted from the WHO SAGE Values Framework, and as we have gone through this entire experience of COVID-19, we have leaned heavily on the experience and technical expertise of the WHO to provide guidance. And again, we are doing this in terms of the guiding principles around how vaccination will be undertaken in the population. As was explained by the minister, we are intending to, and we have made this presentation before in terms of the number of doses and the areas that we intend to get supply from. So right now, our confirmed, these are the anchored confirmed supply facilities for vaccination. So we have COVAX, the African Medical Supply Platform. We have the donation from India. We have a conversation that is penultimate with Moderna. Also, we have a conversation that is penultimate with the private sector, a private sector interest that has committed 1.5 million doses of the AstraZeneca vaccine. So overall, we have changed the allocation for Moderna based on the instructions of Cabinet. We have looked at the pricing mechanism, and it has been proposed that we only, because of the price point that Moderna is coming in at, we would only take 100,000 doses of the Moderna vaccine. As the minister has pointed out, we are projecting to May that we will have approximately 975,000 vaccines in our arsenal for inoculation. And based on that projection, we intend to roll out the different phases of the implementation of the vaccine. So what are the phases? What are the phases that we're looking at? We have 3 phases. Now, phase 1, as the minister had pointed out, have our government officials, our healthcare workers, the elderly, JDF, etc. Phase 2 has the other public sector workers, the hotel workers, transportation sector, manufacturing sector, banking sector, the agricultural sector. The principle behind phase 1 is that we are looking at the vulnerable groups, the persons who are in high contact areas or are coming into high risk for contamination. We're looking at the persons who are highly vulnerable for negative outcome from infection. And so that is what underpins our phase 1 implementation. Our phase 2 implementation are those persons within the economy or the society that are essential to economic activity. And so we look at the different economic groups and we will be prioritizing those persons. And then our third phase is a general population phase that looks at those persons in the general population who require vaccination. So our target is 65% of the population by March 31, 2022. We already have spoken about who will get it first. So I'll just quickly move to the numbers that are behind that. So we have the Governor General, the Cabinet Ministers, the Members of Parliament, the Senators, the heads of ministries, departments, and agencies, our judges, the parish councillors, and then a special group of persons we identify as service level public sector officers. Those are officers that face the public and therefore are at high risk for contamination from the virus. Overall, that is approximately 5,600 persons approximately. The next group of who will get it first is the healthcare staff in the private and public sector. And so we are not only looking at the clinical staff, we're looking at administrative staff as well. We are still getting some numbers from our private sector stakeholders in terms of the administrative staff in their office, their receptionists, the cleaners, etc. All of those persons are part of what we call the healthcare system and are part of who we will try to vaccinate in phase 1. Right now, our numbers are looking like 25,000 persons in that group. The next set of persons, the elderly, those numbers are still being refined. We have the information from Statin, but we're still refining those numbers. We have the Jamaica Defense Force. We have Jamaica the police, Constabulary Force. There you go, the Jamaica Constabulary Force. And as outlined last week, the schools. The schools now form part of our phase 1 operation, and we're looking not only at primary and secondary schools in the public setting, but in the private setting as well. And we're not looking at teachers only, but we're looking at administrative and management in the schools. Also, we're looking at early childhood centers or early childhood institutions. Our numbers look like approximately 18,203, and those numbers too are being refined. We have Department of Corrections, we have PICA, and we have Jamaica Customs. We're still waiting on some numbers there. So based on that, in terms of where we are, based on our surveys that we have done, we are getting around 30 to 45% of the persons who say they will take the vaccine. We have another 25 to 30% of the population who say, we're not sure, we'll think about it, we want some more information. And then we have another 25 to 30% who say definitely they will not be taking the vaccine. So we, in terms of setting a target, is looking for 65% of that population, or of that population that we will reach. And when we do the 65% of the total population based on the numbers that we have right now, we're looking at approximately 248,000 persons in phase 1 that we would attempt to reach over the period. So in terms of a demand supply side, we know what phase 1 looks like, we know what phase 2 looks like, we know what phase 3 looks like. Now let's look at the appointment process. So once you are identified in a group, phase 1, phase 2, phase 3, a public call will be made. Now, currently, a lot of the public health institutions, the public health departments across the island have been reaching out to the different groups in phase one, and they have been identifying those persons who definitively say that they want to take the vaccine, and they have been collecting their data. So as we move to the different phases, though, we will be making more a public call for persons in phase one, like the teachers, or we're making a public call for persons in phase two, persons in the banking sector, etc. Now, if you wish to get an appointment, you must start the appointment process 5 days before you want your actual appointment. And when you ask for your appointment, you have to provide certain information: your age, date of birth, your area of work, comorbidity, your allergies, your address, the venue that you wish to be vaccinated at, your telephone number and email. Basic information that will guide us. Now, you can make this application or this application for appointment in 4 different ways. A call center has been contracted by the Ministry of Health, and that call center will operate our 888 One Love number, and persons will be able to call into the 888 One Love number and make an appointment. The parish health department will also be enabled to take calls from the public or the persons in the different phases and allow them to make an appointment. You will be able as well to go on the Ministry of Health and Wellness's website or the website of any of the regional health authorities and make an appointment. As well as you will be able to walk into any of our public health parish health departments and make appointment there. However, once you walk in or you call in or you enter the information on the website, there will be a prioritization process that will take place. So even though in phase one we're talking about healthcare workers, older healthcare workers will be prioritized over younger healthcare workers. Healthcare workers with comorbidities will be prioritized over healthcare workers without comorbidities. Healthcare workers in high exposure areas, so for example, healthcare workers who work directly on the COVID ward or in A&E, will be prioritized over other healthcare workers that are not in those high exposure areas. A very important part of our prioritization process is the fact that sometimes in some individuals, when they receive the vaccine and their bodies begin to mount a response, they begin to feel unwell for up to 24 to 48 hours. And so we can't vaccinate everyone in a particular area. So if we are vaccinating police officers, we can't vaccinate the entire police station because in one go. We'd have to stagger that vaccination because persons at that station may then become unwell and therefore will be required to stay home. And therefore it compromises the service delivery. After the prioritization process has been done, and this will be done by a software solution that we are acquiring, the next phase will be that a daily vaccination schedule will be prepared. And 3 days before your vaccination appointment, you will get notification of your vaccination date, your venue for vaccination, the time that you will be vaccinated, and other information particular to your circumstance. Once that is done and you have done the vaccination, a second appointment will be made for your second dose. And we'll call, and as you know, most of the vaccines that we are getting are 2-dose vaccines, and therefore majority of persons will be required to take 2 doses, and so you will have to run this process twice. Next. So what happens at our vaccination centers? Our vaccination centers has 5 stages: registration, counseling, vaccine administration, observation, and documentation. Now, each stage, we have done a time and motion calculation, and each stage of the process requires some time. So we're looking at a minimum throughput of 35 minutes with a maximum throughput of 52 minutes. Now, what makes the difference? The difference lies in stage 4. For those persons who have no history of allergic response, they will only be observed for 15 minutes. However, for those persons who have histories of allergic response, the recommendation is that they be observed for 30 minutes. So that is what drives, to a large extent, the difference in times that is being proposed in the time and motion experience. The number of staff that we will have, depending on the different stages, we have community health aides, we have records management officers, we have health education officers, we have public health nurses, we have doctors, we have clerks, and all of these persons are a part of the arsenal that is required for every vaccination center. Next. Now, there are 3 levels of vaccination centers that we have, or vaccination programs that we have. At level 1, we have approximately 56 vaccination centers. And at each of those vaccination centers, we have approximately 2 or more vaccinators. And the vaccinators are what drives the vaccination per day volume. Our estimation, based on our time and motion calculation, is that each vaccinator can do 6 vaccinations within an hour. And the vaccination centers will operate for 5 hours during the day. So each vaccinator will produce 30 vaccinations per day. With that type of calculation, we recognize that we will be able to vaccinate at level 1 3,720 persons per day. However, level 1 vaccination is a 3-day process where our health facilities will operate for 3 days. When we move to level 2 operation, it is for 5 days that we will be operating. However, for level 3, or what we call our blitz operation, we will now move to a 1,000 persons per day operation, where we identify mega sites for vaccination. And those mega sites will be able to have a throughput of at least 1,000 vaccinations per day. It is anticipated that we will have at least 19 such sites across the island, producing 19,000 vaccinations per day. Next. However, these sites will only operate on the weekends, Fridays, Saturdays, and Sundays. The logistics for these sites will be managed by the Jamaica Defense Force as per cabinet instructions, and at least one per parish, with the exception of the larger parishes. Next. So, for our level 1 operation, it will be managed by our existing public health team. For our level 2 operation, it will be managed also by our public health team. However, for our blitz operation, it will be a joint effort of all possible persons that can facilitate the investment in vaccination over the period. Public sector health workers, private sector health workers, Jamaica Defense Force, civil society groups like the Red Cross, the general public, and based on instructions given from Cabinet, the Minister of Health and Wellness will be asked to provide special dispensations to look at some other groups that can be included in the arsenal of persons that can do vaccination. This design is what the Blitz sites will look like. They will have at least 5 registration desks. They will have 5 registrations counseling centers, 34 vaccinators with a throughput of 6 vaccines administered per hour for 5 hours, which gives us our 1,000 vaccines per day. There will be 5 observation centers and 5 documentation centers where your vaccination card will be provided to you at the end of the process, and your second dose appointment will be made. The staffing levels are outlined, and I'll just quickly move through that, because so level 1, we move on to level 2, next slide, and then level 3, and we have the staffing levels for all 3 levels. Now, based on that throughput and based on those levels of operation, we are anticipating our capacity for vaccination over the 12 months to look like this, where our maximum vaccination per month will be approximately 302, but we start at the low end in terms of our capacity at 74,000 vaccines per month. So, implementation of this. In March, we will begin our vaccination based on the donation from India and based on our information around COVAX, providing the additional some 14,000, which gives us about 64,000 committed vaccines for March. We start with our government officials, then our healthcare workers, then we move to the Jamaica Defense Force and the Jamaica Constabulary Force. In April, we begin the vaccination for the elderly, the Jamaica Fire Brigade. We begin the vaccination of schools, Department of Correctional Services, and PICA, the Passport and Immigration Citizenship Agency. We gave our first dose in March and April, and the second dose in May and June. So, by the end of June, we will have completed phase 1 implementation, all things being equal. For phase 2, we begin in May. And in that period, we will start with our public sector workers and the transportation sector. Then we will move to continue the vaccination for our transportation workers, and then the agriculture sector will be added. And then we'll add hotel workers and manufacturing sector and the banking sector. And of course, we do our second dose application at least 4 to 8 weeks after the 4 dose, based on the information that we have. And then finally, our phase 3 implementation will be the general public. And we would run that program as we move through the different months. So overall, we will begin and end phase 1, March to June. Phase 2 will begin and end May and end on October. And phase 3 will begin August and end in March. So there's some overlap. Based on that, we have a distribution of vaccines based on our capacity that is displayed on your screen. And next. That's where we will end. Thank you very much, Minister.